Özel konuşup direkt.
Okay, knock knock. I'm gonna close the curtains, give us some privacy. Hello.
Hi.
Hi, my name is Amina and I will be your nurse. Can you just give me your name?
I'm Alma.
And what's your last name?
Abdevich.
Okay, I'm Abdevich. And what is your date of birth?
January 26, 1999.
Fantastic. Can you tell me if you have any allergies?
No.
Okay, and are you experiencing any pain? On a scale of 0 to 10, what would you rate your pain if you did experience?
No, I didn't have.
No pain? Okay. I will do a head-to-toe assessment on you for your yearly checkup. Do you have your permission?
Of course.
Okay. It will take us about 15 minutes. We will start by doing a general appearance assessment of our patient. Our patient does not seem to be in any acute distress. Her facial expression is benign. Her mood is appropriate for the occasion. The couple of questions we have asked her shows us that her speech is clear and well articulated. Can you give me your name, please?
Alma Abdevich.
Okay. Do you know where you are?
In hospital.
In the hospital. Do you know what time it is?
It's 10 a.m.
Okay. And do you know why you're here?
I have doctor appointment.
Okay. The patient is alert and oriented times 4. We will move on to inspecting her skin, nails. Okay. Thank you very much. The color of her skin is homogeneous. There's no wounds, incisions, or lesions on her skin. Her nails also have a pink undertone. Shape is good. No signs of clubbing. Capillary refill under 3 seconds. Very good, excellent. Palpation of the skin shows that the skin is warm. It is very good. We are going to move to her head and face. Her facial features are symmetric. Inspection palpation of her head shows no signs of infestation and no lesions. We will now assess her cranial nerves 5 and 7. We're going to start with the sensory function of cranial nerve 5. Can you please tell me where you feel this?
Cheek, forehead, chin.
Fantastic. So sensory assessment of our cranial nerve 5 is intact. Can you smile? Can you frown? Puff up your cheeks. Okay. Can you chew? Okay, fantastic. So cranial nerves 5 and 7 are intact. Motor function is intact. Patient able to chew, smile, frown, and puff up her cheeks. Can you shrug your shoulders? Okay. Move your head against my hand. Okay. Alrighty. Cranial nerve 11 also intact. Patient able to raise her shoulders and rotate head bilaterally. Excuse me. We'll stay on the face and we will assess her eyes. External ocular structures show no signs of discharge or redness. Pupil size is about a 4. Pupils are equal and round. Reactive to light and accommodate. Conjunctiva is pink and moist. Sclera is china white. Can you follow my pen, please? All right, a couple more. Alrighty. Cranial nerves 3, 4, and 6 are intact. Patient able to follow in all 6 cardinal fields of gaze. Staying on the face, we move on with the nose. Nose is symmetric, no deformities, no signs of inflammation or drainage. Can you? Okay. Bilateral patency of nares assessed. That's very good. Her ears are symmetrical, well positioned. No signs of redness, swelling, or discharge. Okay. I will whisper something behind you, and I need you to tell me what I whispered. Can you close that side? Okay.
Chocolate.
Okay, can you close this side now?
Ice cream.
Fantastic. Cranial nerve number 8 assessed. Patient successfully able to repeat whispered words. We're now moving on to her mouth. Her lips are pink and moist. Can you open your tongue? Is pink and moist. Gums also pink and moist. Stick out your tongue and say ah. Okay. Can you stick out your tongue and move it side to side? Okay. And also, can you swallow? Okay, fantastic. I will palpate her carotid pulses one side at a time. Don't want to cause a patient to pass out. Alrighty. Her tongue, lips, and gums are pink and moist. We have assessed cranial nerves 9 and 10. Patient able to swallow. Uvula rises and falls. Her tongue protrudes midline and able to move side to side, which means her cranial nerve 12 is intact. And we also palpated carotid pulses, and pulses were regular, and strength was 2+. Fantastic. That concludes our head, neck, face, eyes, nose, ears, mouth assessment. We will move down to respiratory. Patient does not appear to be using any accessory muscles. I will auscultate anteriorly in a side-to-side pattern. Her right upper lobe, right middle lobe, right lower lobe, left upper lobe, and left lower lobe. Like I said, I will do side by side, and what I'm looking for is clear breath sounds with no additional sounds, no adventitious sounds. I will repeat the same auscultation posteriorly, also going in the side-to-side pattern, listening to her right upper lobe, right lower lobe, left upper lobe, and left lower lobe, and I will verbalize what I'm doing. Alrighty, I will have to go under your shirt if that is okay.
Of course.
Okay. I'm sorry if my stethoscope is a little cold. Okay. Alrighty. Okay, so we're doing right upper lobe, moving side to side fashion to left upper lobe. Very good breath sounds. Okay. 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 Clear breath sounds, no adventitious sounds heard. I will move on posteriorly. Okay, we will start with the left upper lobe, right upper lobe, left lower lobe, and right lower lobe. Fantastic. We will move on to cardiovascular assessment and peripheral vascular assessment. I will listen to 5 areas with both my diaphragm and my bell. On the right side, second intercostal space, I will listen to the aortic valve. Then we'll move on to the left side, and I will listen to pulmonic in the second intercostal space, Erb's point in the third intercostal space, tricuspid in the fourth intercostal space, and then also mitral in the fifth intercostal mid-clavicular line space. If we were to assess the apical pulse, I would stay there for 1 full minute. What I'm looking for is to hear S1 and S2 with no additional sounds and no murmurs. I will also have to go under your shirt again. Do I give permission?
Of course.
Alrighty. So we're going to start with the diaphragm. Okay. Aortic. Okay. Pulmonic. Erb's point. Okay. Tricuspid. Okay, mitral. Very good. I'll repeat with my bell. Aortic, pulmonic, Herb's point, tricuspid, and mitral. Very good. S1 and S2 heard, no additional sounds heard, and no murmurs heard. I will now do I'll palpate her radial pulses. Okay. Very good. They're equal, bilateral, regular, 2+ strength. I will now palpate her dorsalis pedis pulses and her posterior tibialis pulses. Okay, so there's no edema present. Pedialis, dorsalis pedialis pulses are equal, bilateral, regular, 2+. I will wrap my fingers around her ankles and palpate her posterior tibialis pulses. They're also equal, bilateral, regular, and 2+. Very good. That concludes our cardiovascular and peripheral vascular assessment. We will move over to musculoskeletal. We will be assessing one major, one minor joint in the upper extremity, one major and one minor joint in the lower extremity. We will do her elbow, her wrist, her knee, and her ankles. I will look for contour, symmetry, and range of motion. We will do muscle strength as well as sensory. So starting off with the elbows and wrists, her joints are symmetric, contour is appropriate for her gender and age. Also her knees are symmetric, her ankles also symmetric, there's no deformities, and contour is appropriate for her age and gender. Can you lift your arms? Okay. Flexion and extension, side to side deviation. Can you lift your legs? Put your legs down. Okay. Now just your dorsal extension and plantar extension. Fantastic. Please tell me what you feel.
Soft, sharp, dull, sharp, soft.
Fantastic. So the sensory function of her lower extremities assessed. Lift your arms. Okay, can you pull towards you? Push. Okay, same thing. Pull, push. Fantastic. And the motor function of her upper extremities and lower extremities also assessed. The strength is 5. One thing you haven't had a chance to see is her gait when she walked in. Her gait is smooth and steady, uncoordinated, no ambulatory aid use. One thing we have not done is abdominal assessment. If the patient were to have a chance to lay down, we would inspect her abdomen for symmetry and contour. We would expect the abdomen to be symmetrical, the contour to be flat to round, skin color to be homogeneous, her umbilicus to be midline and inverted. We would then move on to auscultating the 4 abdominal quadrants in the specific order of right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. We will look for active bowel sounds in all 4 quadrants. In case we didn't hear one with the diaphragm, we would stay in that same spot for 5 minutes. And then we would move on to light palpation of the exact same quadrants, and we'll be looking for tenderness and distension. What's left to do is to ask the patient, are you in any pain?
No.
No? Okay. If the patient was in a bed, I would have the bed in the lowest position, locked, side rails up, call light in reach. I would thank the patient and repeat hand hygiene again. Thank you very much.
Thank you. Bye.
Bye.